Hello everyone. Today we are going to see about the dermatological conditions in pregnancy, which is generally commonly asked in USMLE. The first is the melasma. Melasma is one of the most common dermatological condition. It is also known as cholasma. So what is basically melasma and why does it happen? In pregnancy, because of the increase in the estrogen and progesterone, they increase the melanin. So the melanin will result in an increased dark pigmentation or hyperpigmentation happens. So this condition is known as melasma or cholasma. So they mostly have hyperpigmentation over the cheeks and the forehead. It is also said that it increases with increase in the sun exposure. Increase in sun exposure. So mostly treatment is necessary, but so reassurance. What we have to know about this condition is that there is a DD for melasma. It is nothing but hereditary hemochromatosis. So what is hereditary hemochromatosis? Hereditary hemochromatosis is a genetic condition where we will have an increase in the iron overload. So generally in females, hereditary hemochromatosis presents late, isn't it? Because of the menstruation. So because of menstruation, the females will be losing blood, hereditary hemochromatosis. So because of menstruation, the females will be losing blood every month. So iron overload will not be that much high as compared to their male counterpart. But during pregnancy, with this absence of menstruation, they will be having an increase of iron overload in their body, and there are chances that during pregnancy it will present as melasma, that is a bronze diabetes. There will be facial discoloration. Therefore, the only thing which we need to remember is when we diagnose a patient with the melasma or cholasma is that patient might be having hereditary hemochromatosis. Fine. So what are we supposed to, how to differentiate between these two? We need to check the ferritin levels. So if the ferritin levels are more than 300 micrograms, then it points towards hereditary chromatosis. If it is less, then we are all good and we can proceed with our melasma diagnosis. Now what is the second common dermatological condition that happens? The second condition is PUPP, that is Pruritic, Urticarial, Plaques and Papules. So what does it? Just with the name we know that it presents as there will be itchy papules or plaques. So where does it generally happen? This happens along the stretch marks. Okay. So if we see what is the reason for this, the reason is unknown. The reason is unknown. So since it occurs in the stretch marks, usually topical steroids and oral antihistamines generally works well. So the patient will actually present with around the umbilicus, that is where there are more stretch marks. They will be having intense itchy red or erythematous papules or plaques, and that can spread to the limbs as well as the buttocks. Okay. So what we need to know is this is generally a benign condition. But there is a differential diagnosis for PUPP, that is which presents almost similar to PUPP, that is pemphigoid gestationis. Pemphigoid gestationis. So there is it is also known as herpes gestationis. So this has nothing to do with herpes, but I don't know, it is also known as herpes gestationis. So this also presents similar to PUPP, that is there will be a papules around the umbilicus mostly, fine, but this presentation will be papules. But what we need to know is this happens in the third trimester of pregnancy, and what is the reason behind it? So just like bullous pemphigoid, here too there will be IgG antibodies against the hemidesmosomes. So resulting in this papules. around the umbilicus. But the fatal aspect is the IgG antibodies can cross the placenta and it can enter the fetus. So, in the fetus, there are chances that the low birth weight or else preterm delivery. So, fetal monitoring is very important. So, though it presents almost similar to PUPP, pemphigoid gestationis, we need there is a it can affect the fetus and it will result in low birth weight and preterm delivery. Okay, so therefore we need to check for IgG antibodies against the hemidysbosomes. The other condition which is quite common we are going to see about is intrahepatic cholestasis of pregnancy. So, what happens in pregnancy? Because of the hormones, there will be the liver does not secrete the bile acids. So, there is an increase in the serum bile acids. So, because of an increase in the serum bile acids in pregnancy, the patient will be having itching or pruritus of the palms and the soles. So, this is how, so you see intrahepatic cholestasis. So, the bile acids are being present intrahepatic inside. So, therefore, it will result in an increase in the serum bile acids. So, the patient will generally present with pruritus of the palms and the soles. So, this is generally a benign condition. So, the treatment is ursodeoxycholic acid. What we need to know is this can result in, so this will present during the third trimester of pregnancy and this can result in third trimester spontaneous abortion. So, that is what we need to be careful about. Third trimester spontaneous abortion. So, even though the patient presents with just pruritus of the, and you have diagnosed it by seeing the blood tests that there is only elevation of the bile acids, what we need to, and treated with ursodeoxycholic acid, what we need to be careful is we need to watch out for the third trimester spontaneous abortion. So, we need to keep monitoring the patient during the third trimester. The last condition is fatty liver of pregnancy. So, what happens in fatty liver of pregnancy is there is an enzyme defect. So, what is the enzyme defect? Enzyme defect is LCHAD, that is the long chain hydroxy acyl coenzyme A dehydrogenase enzyme defect in the fetal liver. So, this results in impaired mitochondrial fatty acid oxidation. So, this is generally fatal. So, the patient will and the most important thing is how it presents. It does not show that it is lethal at all. So, it will present with nausea and vomiting, it will present with abdominal pain in the right upper quadrant abdominal pain. So, whenever a pregnant woman presents with nausea and vomiting, we do not take it much seriously, right? But this condition it presents in the third trimester. So, nausea and vomiting during third trimester, we should again, we should start rethinking our diagnosis. And the patient will also present with right upper quadrant pain. And after that, the patient will present with jaundice. So, with all the symptoms, we need to do blood tests, that is a liver function test, renal function test, as well as the coagulopathy test. So, everything is deranged. So, the best idea to cure the disease is early diagnosis of fatty liver of pregnancy, and the treatment is termination of pregnancy. See, this is usually going to present in the third trimester. So, the best treatment is you need to deliver the baby, even though if it is going to be preterm, it's okay, because otherwise this will result in a fate in the baby, and it will risk the lives of the mother as well as the baby. So, and the key is early diagnosis. That's what. So, today if you had come this far, these are the important topics which they generally ask in USMLE. So, today we have read about melasma, you have learnt about PUPP, and an important diagnosis of differential diagnosis of that is bullous pemphigoid. and intrahepatic cholestasis of pregnancy, which is again benign, and also fatty liver of pregnancy. Thank you. I wish you good luck for your exams.